Good morning. Today it is Monday. It's February 12th. The year is 2024. So Dexter Scott King, Dr. Martin Luther King's son, passed away from prostate cancer. He battled it for about a decade, 10 years, or maybe a little bit longer. Prostate cancer is a very common form of cancer for men, particularly black men. Forget my dogs. They're still in the cage because it's raining outside and I ain't took them out yet, so they'll settle down in a minute. But I believe he could have avoided prostate cancer. Prostate cancer, there's a lot of research on prostate cancer and the relevance of testosterone in a man's body. You used to believe that prostate cancer and prostate issues were caused by testosterone or too much testosterone. But now they know that the problem isn't too much testosterone, it's a lack of testosterone. Low testosterone is the issue. And now you have doctors who are treating men who have prostate cancers or prostate issues with testosterone. They're giving them testosterone to alleviate the problems with enlarged prostate cancer, and all this stuff. So if he's had this issue going back like a decade, the science probably hadn't caught up to his doctors before while they were treating him for this. For what I understand, he went around the world wealthy. He's a wealthy black man. Let's just face it, the King family, there were millions. He went around the world trying to resolve this issue. I started taking testosterone in 2001, 2002, when I was 31, 32 years of age. I'm 53 now. Just over 20 years of testosterone treatment because my testosterone levels were so low in my 20s. I suspect Dexter King's testosterone levels were low leading up to his 30s, 40s, 50s when he ran into prostate issues. He wasn't on testosterone, nor was he being treated with testosterone. Because had he been treated with testosterone, he would not have had prostate cancer. So it's very important as a black man. I'm doing this video for black men because I know so many black men who've had prostate cancer, enlarged prostate. You must get your testosterone level checked and get on some type of TRT treatment with testosterone or you gonna die. Point blank. You better find you a doctor, a smart doctor, an intelligent doctor, a doctor who's up on all the science. Now, keep in mind, doctors don't have to go back for continuing education classes like everybody else have to do. A bus driver got to keep going. They'll pull a bus driver off a bus and say, okay, you got to take some more classes to drive this damn bus. But doctors don't. And the science passes them by. Prime example, years ago when I went to go see my doctor that I'd had for decades about PrEP, I had contacted Gilead, the manufacturer of PrEP. PrEP is the pill Novadex. I can't think of the name of it. It's a medicine to keep you from contracting HIV. I did all this research on it. Gilead had signed me up for a program, got it approved. This is a very expensive medication. Now, this has just been approved for use for people who were HIV negative. I got it approved. I was all excited. I said, all you need now is get your doctor to give you prescriptions. I said, okay. So I got my little paperwork together, made a doctor's appointment, went to my doctor's office, right in the doctor's office, got all my little stuff, talking to her, and her face was lit up like, I'm not doing this. I said, well, why? She said, I've never heard of this before. What is this? I'm explaining to her what it was. I'm giving the paperwork, and she's just like, I don't know about this, Mr. Walter. This is the first I've ever heard of this. I said, you never heard of PrEP? You've never heard of this? She said, I've never heard of this. So she said, but do you mind if I keep all this stuff and read this stuff and do some research on this? She said, and then I'll be in touch with you. But she said, I can't, let me, I've never heard of this before. She was just in total shock. But this was all over the news. It was this great way to stop people from being who were negative to put them a pill that you could take that would prevent you from catching HIV. We went round and round that day, but I gave her some. She said, "Just let me do some research." So sure enough, about a couple of weeks later, she called me. She reached out. She said, "Okay, I've done a lot of research. Let's talk about this." We got in. My doctor was very conservative. She talking about safe sex and this and that, this, that. I know about safe sex. I've been practicing safe sex all my life long, but this pill is here, and I own it. And we talked about the side effects of the pill, the possibilities of it. We went over. We sat there for a long time talking. She said, "Is this what you want to do?" I said, "Yeah, this is what I want to do." I'm very aware. I'm for science and medicine. I don't know about the rest of y'all idiots. Shit, that was back in, gosh, what year? That had to have been like 2012, 2012? 2011, 12, somewhere there. Anyway, that's how long ago this shit was. So I had to convince my doctor, before she wrote that prescription for that prep. And then next thing I know, as I would go to my doctor's appointment, I see signs all over her office, posters up for prep. I'm like, okay, so they didn't really, change her mind, really changed about it. She's pushing prep. You on prep. She was pushing because now she had the science. She did her research. Remember, like I said, doctors don't have continuing education classes. They need to. That's why when you go to your doctor and you research something and your doctor don't understand it, go to another doctor. Dexter King would still be alive now had they put this man on testosterone when he started having prostate issues. They know now that if you have prostate issues, increase the testosterone, elevate it dramatically, and it will alleviate those problems and eliminate the risk of this turning to cancer. But not all doctors know this. They all don't know it yet, y'all. You have got to do your research. You've got to find you a doctor who's smart, intelligent. You can be even going to a specialist on prostate, and he don't know. Because I've had this conversation with a couple people I know having prostate issues, and I said, you need to find you another doctor, and fast, or you're going to die. You can try to take your doctor. Doctors are very arrogant. They went to school, they did all this work, they blah, blah, blah. But they're still not doing continuing education, and that's the part that bothers me. Because science is changing every single day. Some things they did 2 years ago, they're not doing in 2024. They realize, that ain't working. And if your doctor ain't up to speed on this shit. So as an African-American black man, the risk of colon cancer, prostate cancer, all this stuff is hot down there. Like I said, down at that asshole, down there can kill your ass. Anal cancer, colon cancer, all those could be prevented by increasing your testosterone levels. They have the science to prove this now. But again, do your research, find your doctor who understands that I can only take you to the water because I can't make y'all ignorant ass to drink. Some people there's this fear. But Dexter King travels the whole wide world. The first thing you want to do in your 30s, you go for a checkup. In your late 20s, early 30s, you say, doctors, check my testosterone and estrogen level, because they won't check those levels unless you ask. They'll check everything else, but they don't check their testosterone level unless you request it. If you don't request it, they ain't checking it. So you have to say, I want my testosterone level checked every time you have a checkup. And if that number gets too low, because it's set on it's like a parameter. If you're 30 years of age, if you're 32 years of age, it should be this range. I don't like that shit. I personally keep my testosterone level set between 1,000 and 1,500. And I was, it's so high. I said, I don't give a fuck. This is what I'm doing. This is what's best for me. Fuck what the rest of you niggas doing. I know what's good for my health. Here I am, 53 years old. I ain't had not any health problem. They check every damn thing. So everything's fine with you. I work out, I exercise, I eat right, I drink my good cup of coffee every day. And natural ingredient food is good for your liver and help you have a good shit afterwards. This coffee getting a little chilly. Well, Dexter King he traveled the world and spent millions. All the man needed was some testosterone. That's it. But by that time, the cancer had spread so far. Had that man been on testosterone in his late 30s or early 40s, or I started in my early 30s, he probably didn't even know. If you go into a doctor and you can check your testosterone level, because you are a man, we need testosterone in our bodies. And if that test level is too low, they got to give you testosterone. Or you're going to have a hell of a lot of health problems coming up. A lot of health. You're going to have heart problems. Low testosterone can cause heart disease, heart problems, kidney problems. They know all this now. They know that as you age, your testosterone levels drop, and it creates all these health issues. But again, because doctors are not having continuing education, and some doctors have never been trained on this, period. And trying to talk to these doctors, I already know it's a struggle. Woo! You want to fight somebody one day, go to a doctor's office. Them motherfuckers swear they Jesus in there. And I don't deal with doctors like that. If we can't see eye to eye, I'm out. I like to go see the same doctor so you can look through my medical chart about this thick. They pull it out, look at it, and they say, okay. Well, now they have the digital chart. Because I started with paper, they actually have a medical. When I left that one doctor, they sent my medical file over there to them so they can see. So I'm going back 20 years. But it's all supposed to be digital now. I don't know how that works, but every time I see they have a little thing they pull out, I was like, y'all still got that thing? Y'all ain't put that shit on digital yet. I don't know how that works. I thought they were supposed to put all this stuff in digital and scan it and do all this other shit. And they said, fuck it. Do that shit right the way it is, nigga, halfway through his life. Since us digitizing all this shit, he may be dead in a few years. I'm like, what'd you say? Mr. Hampton, we ain't digitizing your file. You up there, honey. And then the young folks, we gonna digitize theirs. They ain't got much to digitize. A little bit, a couple files with them. Yours, this damn thick. I have my health issues and stuff. I have blood pressure. I take my blood pressure medication. I'm fine. I do need to schedule. I had a colonoscopy this year. I had my colon positive. That was fine. I'm going to take care of my health. I don't care, but I don't know about the rest of you niggas. Y'all can do the fuck y'all want to. Y'all can sit up there and smoke hookah all night, smoke weed, do drugs, party, liquor. Now, I brought up that liquor. They know for some reason younger and younger people are having colon cancer. Y'all is the fucking liquor. When I was in my early 20s, I drank occasionally. When we would go out to a club, occasionally, maybe one drink that night, one, maybe two. Everybody drank, but it wasn't like we would drink. But now, I look at these younger folks drunk, passed out, drinking. It's the liquor. There's a direct correlation between your alcohol intake and colon cancer. If you're a drinker, and you start drinking in your late teens and early 20s, and you can drink consistently, you're going to get colon cancer. How can you avoid it? Stop all that motherfucking drinking. Put the liquor down. It's just too much. Y'all, everybody drunk as a fucking skunk when you go places these days. Drunk and drinking is way. See, when I was growing up, they didn't advertise liquor. Celebrities didn't have. Okay, you had Billy D. Williams with the malt liquor thing. You might drink that shit, but you didn't see the type of advertising that you see now, where you got Puff Daddy with his vodka, or somebody with this whiskey, and these celebrities pumping this liquor. It was a number poison. Yeah, I drink occasionally. This whole weekend, I had nothing to drink, y'all. Nothing. I had brought some vodka. I don't know. I just didn't feel like drinking. I just drank some juice. I watched the football game. I didn't have nothing to drink. Didn't drink none of that vodka. It was just sitting there. even made a glass of it, didn't even drink that. I was like, just drink this glass, make this glass by a vodka. I didn't drink that. I mean, poured it out. She woke up in the middle of the night, was still sitting on the counter. I just didn't drink any. Trying to push back from all that alcohol. I don't drink till I get drunk. I have a drink and go to sleep. Most of the time, halfway through the night, the drunk. I drink about half the drink and it's gone. I think one of the reasons why I'm having difficulty, I switched to a sleep medication called Cuvic. And man, that damn Cuvic, oh my gosh. And if I have a drink when drinking that at nighttime, it intensifies the medication, which causes me to have the most craziest dreams. Dreams where you jump out of bed like, what the fuck did I just dream? So I've kind of cut back on that drinking when I take that Cuvic, because I'm trying to see if I'm going to stay on that Cuvic, because it's kind of an intense medication. It might not be appropriate for me. I'm trying it, but you know what? I may have to go back to Ambien because it's just too intense. I mean, I'm trying to sleep. I ain't trying to watch a 4D dream. You know, like, damn, what the fuck did I just... I mean, every time I wake up after taking that Q, I say, what the fuck did I was... What is... I mean, literally, the dreams are so intense, I don't even know what to say. But it's definitely that sleep medication. I don't know about y'all, but I don't necessarily need an intense dream session. I like pleasant dreams when I'm in bed asleep. So it's kind of hard to explain. You'd have to... If you're taking Cuvic, which is a new... It's supposed to work different on the brain and all this other bullshit, but it's supposed to put you to sleep. But shit, you have your ass jumping out that damn bed screaming. Dexter King could have lived had he kept track of his testosterone levels. When they realized his test levels had plummeted so low, testosterone plays a part with a man's immune system. It's a significant role in our immune system. And if you don't take that testosterone, if you don't have enough testosterone in your system, your immune system goes down, leaving you open to cancer, viruses, bacteria, all kinds of issues. That's why it's central, so important that you get your testosterone levels checked and get on testosterone if your levels are too low. And then people say, oh, I got to take that for the rest of my life. Do you want to live? You better. People ask all the time, are you going to take testosterone your rest of your life? The long as I live on earth. Yeah, motherfuckers. I'm going to take my shot. I'm taking it today. But I can only speak for me. It don't bother me to take that little shot. As a matter of fact, I do it right in my leg now. And get over it. It don't take 2 seconds. But do what's best for you. You've been warned. Find you a smart doctor. Find you a doctor. Get them testosterone levels. Because see, a lot of people ain't getting their levels checked. Now, I would have bet my life that Dexter King never had his levels checked prior to them discovering he had a prostate issue that led to cancer. Had they treated him with testosterone at the very beginning when he had to, they could have beat that cancer. But that's just my thoughts. They have the science to prove it now. May not have had the science to prove it when he first started having that issue. As I say, it's best to be with a doctor who's up. But this man spent millions traveling the world. Remember, his mom died from cancer. They did the same thing, traveled all over the world. She still didn't die from cancer. You know, maybe cancer just runs in the family. You know, who knows? I'm not sure what his mother, she died from cancer, but I'm not sure which form of cancer. And I don't remember what her age was when she died from cancer, too. But Dexter King was 62. Yeah, I think he was 62. You got a lot of men struggling with prostate issues. It is the lack of testosterone in their body. Low levels of testosterone, which is setting them up to have prostate issues and cancer issues. Like I said, colon, prostate, anal cancers, lung issues. There are a lot of issues you can have. Your testosterone plays a significant role in your immune system to protect you. And if it's low, you're going to have a problem. That's just my thoughts. Educate yourself, educate your doctor, I have a great doctor I go to. Well, let's just say I have a doctor that the doctor I go to, the previous doctor I went to for 25 years, she retired. So the doctor I go to now is 3 of them over there, and depending on which one you get, you know, because there's 3 of them working in office. And this is my primary medical doctor. And when I make an appointment, I guess it's time to make an appointment. Getting in close to my birthday, I always try to. I'll be 43, 53. I'll be 33 this year. I'm getting close to my 33rd birthday. So as I get close to birthday number 33, I hear the doctor get everything checked out. Two of the doctors are pretty good at my office. This one, oh gosh, I hate to get it go to her ass. She's just too inquisitive. When I go to the main doctor, my main doctor, the one whose practice it is, he don't give a fuck. He gives you this, that, and the other. You want that test? You want this, boom, out. Bye. See you later. See you next time. I like his ass. I like to see him. I don't have no issues. Yeah, well, I asked for, he said you can have it. Your medical insurance cover, here, take it. You know, shit, take it, man. Like, you old enough to be my damn dad. Take what you want. You know. Anyway, it's going on. Let me take these dogs. It's raining outside. I guess I'm going to take them out after I use the bathroom. This coffee is doing what it's supposed to do. Today is Monday, February 12th. The year is 2024. It's a beautiful Monday morning. I enjoyed watching the Super Bowl last night. I think Usher did a great job. Very entertaining. Love when he came out on those skates. I don't know. It's just amazing the dance and the moving they were doing them skates. I was just looking to see if somebody was going to fall. I said, ooh, somebody going to get by and they didn't fall. It was amazing. So anyway, let me get my day started. Today is Monday, February 12th, the year 2024. I'm out of here. Y'all enjoy the rest of this beautiful Monday morning.